AI, GLP-1s, federal policy, and China. Those themes dominated last week's JP Morgan Healthcare Conference in San Francisco. But what, if anything, are the implications for the broader healthcare world in 2026? Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the chairman of UConn Health. And David, it was a lovely week in San Francisco, warm and sunny, which it rarely is. And is it a warm and sunny time for the healthcare industry? We shared quick takes last week. Now we're going to go into the deep grooves. What are the big themes for healthcare in 2026 based on our quick insights?
John, one of the things that
JP Morgan.
One of the things, John, that I saw on the sidelines of JP Morgan is somebody mentioned, hey, it's sunny in San Francisco. That means healthcare stocks are going to go up in the first half of the year. I don't know if there's really that effect or not.
Not a buyer.
John, there was a generally positive attitude out there. And there's a couple items that were featured this year and last year, and maybe now this year at a little more mature level. So one is certainly about AI and the impact from that. And the other one is GLP-1. So there's, I think, sun on both of those, but a little bit more substance.
I think that, the four things that I think were themes worth digging into. The GLP-1 craze feels like it's just getting started, whether it's in pharma, healthcare services, health plans, or individuals. You've got AI talk everywhere. I think, Dave, we should also talk a little bit about China. There's sort of the specter of China taking the lead in healthcare innovation. And then I do think it was generally an optimistic moment. I mean, obviously there was a cloud last year post the assassination of the United Health CEO. But I think people are generally pretty positive. Let's go in order, Dave. What did you have the same impression on GLP-1s being still sort of a monster wave?
Yeah. So what's interesting about GLP-1s, John, is that you've got both the expansion into other indications beyond obesity, but then also the question of sort of the sustainability. And is this something that people are going to take for a long time? So you've got the products that are having a good impact on weight loss in particular. It's measurable. They're also finding if people go off the drugs, it means that their weight comes back. So in pharma world, it's actually kind of good.
Oh, Dave, such a cynical view. So these are the products, or the GLP-1s are those products that are the appetite suppressants that historically that have been probably one of the they're growing, their popularity is as great as ChatGPT. It's one of the fastest growing consumer products that I've seen in pharma, because there's the direct use of those appetite suppressants for folks who've got chronic metabolic disease, who are struggling with their weight control and diabetes. And now we're seeing for those same appetite suppressants the fact that it appears to be anti-addictive and also may have a pretty big impact on cardiac health. And so when you add that cool cardio and metabolic category, it's a pretty monster. Those are monstrously large categories of what drives chronic illness in the U.S. The other thing that's sort of interesting, Dave, is that initially 2/3 of the people who started on these drugs, which were injectables with either an auto pen or a conventional syringe, were not taking it, and so they were not staying on those drugs, and so they would drop off. What was interesting right before we got into JP Morgan is the introduction of orals, where people can start taking pills as opposed to having a syringe. And I think that could actually affect whether people stay on these drugs. And the amount of interest on the part of pharma, because these are so popular and appear to affect or potentially promise to impact and reduce chronic illness across a number of different categories. It seems like nearly every large pharma company is interested in finding new ways to create these kinds of drugs or those like them. And that's got, put a spring in the step of the pharma innovators, not because of the cynical reason you suggested, Dave, but because they appear to be pretty attractive ways to solve maybe break the back of this obesity epidemic.
Well, John, I don't think you're exaggerating, and you're going a little bit with the breadth of the different indications and what it could do for chronic illness in general. I think also the depth is worth exploring, and so there's been diet pill crazes before, like with fen-phen. Now, some of those issues, there's side effects, but also they just don't work as well. So the GLP-1s actually have a really profound impact on, on weight. And you saw there were a couple indicators of it recently that I would point to. One, there was actually an analyst report that was talking about, the airlines are going to be spending less on fuel because they think the passengers are lighter. That strikes me as would be surprising, but that's got a lot of attention. And then there was, if you look at what's the impact on a population level, you can see sort of state by state obesity levels over time that gets reported. Now the data are lagging, the government data, but Gallup did a recent poll of thousands of people, and they asked about their height and their weight, and they calculated the BMI. And what they're showing is that obesity is declining for the first time after increasing sort of for as far back as the eye can see.
Well, I'm not necessarily a believer that people are going to admit whether they're putting on a few extra pounds or not, but you're hearing about it in analyst reports and quarterly earnings of fast food manufacturers, of effectively the fast food restaurants, the places where folks have historically gotten high caloric, not necessarily the healthiest foods. Those food manufacturers, distributors, and restaurants are talking about a decline, and it's certainly having an impact in the restaurant industry, and it also appears to have an impact or maybe tied to the reduction in the use of alcohol, which also could be. All of this, Dave, for all of the healthcare noise, this is a very good public health outcome if, in fact, these drugs and the change in behavior can be continued. I mean, isn't this good news for the American public health system?
Well, I don't really care about that, John, but you mentioned some other areas where there's an impact. So certainly there may be some businesses like alcohol and fast food that are maybe negatively affected. But I think you were pointing to also kind of the ecosystem, which is if it's important for someone to stay on the product, it's not enough just to have it, even frankly, if it's in pill form. And so what I'm excited about is seeing some of these companies that are arising to say, make sure let's actually get the benefit out of it. So keeping people on the product for longer, making sure that when they lose weight and, including muscle, perhaps sometimes often a lot of muscle, that they actually get into a strength training program, that the diet is going in the right direction. And so I think there's a lot of interesting healthcare services businesses around it. So it's not just the fact that all the pharmas are interested in it, but what about all the other surrounding businesses?
The companion businesses that would help people get the most out of these drugs. I'm surprised at how big this has become and how large an interest pharma has in this. But you're absolutely right. There are going to be a lot of companion businesses that are tied to this, keeping people on the drugs and making sure that people are actually stay healthy. Because there are some profound examples of muscle wasting when you lose too much weight too quickly, or you have a hard time eating enough protein to kind of stay on top of things. So, Dave, what would be, other than the GLP-1s and pharma having a spring in their step, other big themes did you observe out of JP Morgan?
So we touched on AI quite a bit last week, so maybe let's just keep it a little bit focused. And one is that you've got these announcements about from the LLMs, the large language models, about actually having something that's healthcare specific and presumably going to be HIPAA compliant. And I wonder whether these announcements actually make a big difference or not. These are also ones where, like obesity, actually everybody's using the LLMs for medical advice now. Is this going to be the dawn of a new era that you've got, healthcare and ChatGPT and Claude?
Well, I think what's interesting is that these hyperscalers with the ability to put an infinite amount of money to work were all over the healthcare conference last week. The people couldn't get a meeting with OpenAI's ChatGPT's team, NVIDIA, the chip manufacturer that creates the chips that power these large language models because they require massive amounts of compute, was having meetings all around the conference. Microsoft was having meetings all around the conference. And a lot of these earlier stage companies like Abridge or Hippocratic or Infinitus, where I'm on the board, were all chock full of meetings, because I think that for the first time that I've seen, certainly, David, in 25 years at JP Morgan, which is sort of the healthcare conference, you're seeing a real convergence of large tech manufacturers, chip manufacturers, software manufacturers, as well as these large language models, trying to find ways, appropriate ways, to work with healthcare companies and power them towards innovation, insight, and cost reduction. I mean, that was probably the theme that we didn't talk about yesterday, is the range of tech company engagement. The reach of it was really quite profound last week.
John, I would have to agree with you on that and say that, what you also saw is the health plans actually stepping away. You don't really see health plans. You see it actually explicitly stepping away, and in some cases, health systems as well. So yeah, I think tech is big there. I also saw that, I don't know if it was the valuation of one of the firms, maybe OpenAI, that was like bigger than all of the pharmaceutical industry combined. Which means that if you think about AI being really important for the future of the pharmaceutical industry, what does it mean about the traditional company's ability to actually compete there if the resources are going elsewhere?
Well, so yeah, I don't think you have to. The valuations themselves, can rocket up and rocket down. I mean, we've seen every new wave of technology, whether it's the .com world, the railroads. You remember, when the railroads started.
I remember,
really
John. I remember.
Over, Dave.
Yeah. In fact, didn't we do a special episode when they had the wedding of the rails out in Orem, Utah? I seem to recall that. Was it Ogden?
There's always over-investment, over-excitement. People forget. You probably remember, Dave, that in the early dawn of the auto industry, there were like 50 or 60 different auto manufacturers, and only 3 or 4 really survived. And so there's always this overemphasis on the new. But I'm reminded of Bill Gates's comment that people overestimate technology's impact in the short term, but underestimate it in the long term. But this convergence of the large enterprises looking for ways to really crack some of the hardest nuts in healthcare, I think was pretty interesting. But I would go back to the notion that I don't think we're going to see the big impact on AI in healthcare in anything other than administrative services. But that's pretty large, with about of our $5 trillion healthcare business industry, about $1 trillion of it's considered excess overhead. That's a pretty big target if you were able to apply AI and large compute to kind of solve some of those administrative hassles. I mean, Dave, where do you think the biggest impact in the short term AI is going to have in healthcare?
I think the biggest impact is actually on enabling the consumer to actually participate more directly. So in the early days of the internet, doctors would complain that a patient brings me this big printout of all this stuff, and I have to spend the whole appointment telling him it's nonsense. And now I would say, well, the physician sees that too, but also the patient can really do it and get a distilled view if they know what they're doing. That's what I see kind of the impact on the clinical side. Certainly there's a big administrative impact as well. John, I want to reserve some time to talk about a topic that you raised that going into JPM, I would not have guessed was going to be a major feature, but coming out of it kind of makes sense that it was, and that's China. And that actually brings together a few different things. One of them is certainly talking about innovation. And, the U.S. has been really the capital of drug development, especially for biotech drugs, and particularly Boston, San Francisco, San Diego. That's where it's all been happening. But there's a heck of a lot of drugs coming out of China now. A lot of products being developed kind of in the early stage. And the reason I say that brings together some themes is that you've got, on the one hand, the partnership that we've had since the end of World War II between the federal government and the major research universities in the U.S. has been under strain, is one way to look at it. You've also got many
under
Chinese
attack, Dave. You're getting too diplomatic. You're protecting the administration. The administration has definitely, been in a little bit of a lawyerly combat with some of the great research institutions in the United States.
So we've got that. Then we've got the FDA, which has become, let's say, less predictable. At least maybe they're going in a reformist direction. Hard to know exactly. We had the current commissioner of the FDA, Marty Makary, was on our show last year, or actually 2024, I guess, at this point.
We called it early.
You've got the FDA. Then you've got immigration. So we've had a lot of Chinese students that have come to the U.S. and have stayed here. But now a lot are returning. And then you've got the question about just, global competition between China and the U.S. So I see this has actually been a big theme that's been discussed, and I think appropriately.
Well, I think, David, what you heard at the JP Morgan conference is a real fear that China is going to accelerate ahead of the U.S. The Chinese universities have already started to try to recruit Chinese American and other professors and researchers to their research institutions, kind of no questions asked. I mean, no sort of like just come over and we'll pay. There is an aggressive agenda on the part of Prime Minister Xi to create a breakthrough leading biotechnology industry, which at least partially is informed by the notion that they see leadership in biotechnology as a national security agenda item for the People's Republic. And hence a lot of capital is going towards that. But honestly, there's a fair amount of skepticism that in an authoritarian regime, you can create the same kind of results as you can in the West with the same kind of scientific rigor. I mean, Dave, you heard some of the criticisms on that. What's your perspective on the promise of Chinese biotechnology?
I'll give you two sides of it. One side is actually I quite think that the Chinese could do very well in biotech for a couple of reasons. One, just the number of people and the fact a lot of them are trained in the same universities where you've got the breakthrough people who are developing things in the U.S. and to some extent in Europe, and a lot of them are back there. And the other thing I'll point to is maybe an analog is if you look at electric vehicles. So Tesla has a huge market share in the U.S., but Elon Musk basically admitted, if you let Chinese vehicles come in to the U.S., which they're currently, prohibitive tariffs that prevent them from doing so, they would take over. And if you look at the capabilities in China, what they've gotten, low cost and high performance electric vehicles there, it just blows away anything that we've got here. So that makes me think that, biotech might follow a similar path. They talk about the cost of developing a drug is $1 billion or something like that. Why is that? Well, maybe it's because no low cost approach has been done. Now, what you're hinting at, John, what you're referring to is I did hear from some people that are actually involved in this is that as they look at the data packages that are coming from some of these earlier stage biotechs in China, the quality of the data is not high. And they see that someone maybe has in-licensed something, but then when they actually dig into it, they're going to find out that there's no there. So those are two sides of it. I would actually say there's no reason to be complacent about it. And I'm giving an anecdotal example with this data package and a more systemic example of the autos. And I think it's probably more like autos.
No, I think that's right, David. And certainly I think if we care about America's competitive leadership, the example you gave, I mean, Tesla in the U.S., BYD China, Tesla can't compete in Europe on the basis of cost, value, feature set, and quality of the car in an open market. And that's happening, and that's why BYD, the lead Chinese auto manufacturer, is likely to be the leading EV car manufacturer in the world. I mean, they've already started to poke ahead of Tesla based on the global numbers, and that would have been unheard of 3 or 4 years ago. I think the same thing is the same shock for Americans happened when the DeepSeek model, the LLM model that China dropped after the U.S. dropped its open AI models with ChatGPT and Anthropic's Claude and Google's Gemini. Although it's interesting right now, Chinese AI authorities are starting to worry about whether they have the capacity to catch up to America. They're very focused on competitiveness there. We need to, I think, be very focused on competitiveness in biotechnology and healthcare innovation, because the Chinese are coming to compete aggressively.
Let's take that automakers biologics comparison one step further. So with the Chinese automakers, there is actually a legitimate concern about, real national security concern about letting Chinese automakers have cars all over American streets, because they've got all these sensors, cameras, and so on. Like, that's an actual threat. Mm-hmm. With biotech, it's not like that. There's not really an argument that says, well, if it cures cancer there, we still shouldn't have it because it's a threat. Actually, you'll see if those products are successful in the clinic in China, that they will come to the rest of the world. I don't think you're going to have trade barriers that actually stop that. And I think that the global companies, mostly American-based, in pharma will in-license those products, and you actually will see that happen, and you will see that industry thrive at the expense of the rest of the world.
Well, but don't underestimate the impact of the national security threat, Dave. I mean, there's definitely, based on open sources, a lot of suggestions that there's a thriving biowarfare infrastructure in China, offensive and defensive. That's clearly happened. That's clearly happening in the Soviet Union. It's one of Putin's priorities, and so they are prepared in the same offensive, the same investment you need to make to defend against biowarfare. Viruses that are meant to impair or kill, or to protect against those. The same thing. The offensive and the defensive technology is similar. There's a lot of interest and certainly a lot of gossip about enhancing, leveraging biotechnology to create enhanced human capabilities and for warfare. There's a lot going on behind the walls of government secrecy that would suggest that China's going to put a lot of resources here that will also have, I think, profoundly good therapeutic uses. But we need to, and perhaps one of the good news about Commissioner Macary's attempts to reform and accelerate drug approval, development, and research, which he has committed to, will put us in a better position to compete, because it would be catastrophic, I think, if we were to lose our leadership position in this category, which is just not just saved a bunch of people, millions of people in our generation. Cancer is now a manageable condition, but is also a pretty critical part of our industry.
So, John, let me end on another negative note, since I'm known for that, apparently. Let's take a look at, sometime back in I think it was in the 80s, around then, the Labour Party in the UK proposed unilateral nuclear disarmament, which is a fringe idea and was kind of laughed out. Now, we actually have gone ahead and done unilateral disarmament by banning the funding of mRNA research here in the U.S. And so let's just point that out and put that in a different context than perhaps it's been described before. Because if you're worried about biowarfare and you decide that you're going to kill the best technology that we have for defending against it, I think that's probably a bad idea.
I couldn't agree with you more.
Great. Well, on that note, we really did enjoy that JP Morgan healthcare conference, and I think we've gotten more positive or negative as we've come back eastward. And I'll say that's it for yet another episode of CareTalk. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the chairman of the UConn Health System. If you liked what you heard or you didn't, we'd love you to subscribe on your favorite service.